Thank you so much, Malit. I think thank you for the humble introduction. I guess it's part of the LinkedIn profile. So, anyways, to start off with, the conversation to start with like a lighter tone. I hope all you guys can see my screen clearly. And I wanted to actually talk about a topic which is called 10x over 10%, which means how can we design technologies and strategies around healthcare where that we can do a 10x impact rather than just like incremental impact, which by just like most of the solutions provide in healthcare. So giving a little bit of background around this conversation, I'll start with the problem statement. So if you guys know, according to the research that was published by the World Health Organization, so the suicide is the second leading cause that affecting people from age of 15 to 29. So that means 265 million people are affected, and almost 800,000 people suicide every year. So when I'm starting this conversation in this tone, you might also know what I'm talking about. And it's not COVID, it's something that has been in the world for a very long time, which is depression. So depression is something that I've been very close to me. And also, like, I've suffered from depression certain times of my life, which led to creating an organization and technologies around detecting depression. I'll tell about these things a bit later. So you can think of like these invincible diseases, right? So if you look at what has been happening in the world, a virus which is like really small that you cannot even see, cannot even pass through like a mask, is affecting global economies. It's affecting like countries. It's affecting politics. And this was the first time in our lifetime that we were able to witness a pandemic at scale. So for the past 2 years, I think 1 year, and this is the second year that we are in the pandemic, and it looks like we still have not beaten it. The moment that we think that we've gone through some way of tackling it, that it comes back much more stronger. And this is one of the reasons that like I wanted to focus on this presentation around problems that we cannot see, especially in the healthcare sector. So I think Malit actually told quite a bit about my background. So in 2 sentences, I'm actually an inventor and been in China for the past 15 years and designing different technologies in healthcare industry 4.0 and artificial intelligence industry. And that give me access for this thing that's called Moonshot Thinking. So Moonshot Thinking is a framework that is introduced by Google, which means like long time ago we had actually the drive or the idea to just tackle bigger problems. Like in 1940s we wanted to go to moon, and then countries were like wanted to put their flag, and people wanted to explore some other boundaries apart from our planet, away from our planet. And over that, after that space race was ended, we kind of started solving smaller problems. We the investment started going into areas which has no 10x return or 10x like increment in terms of societal level. So we actually started investing talent, resources, and every single piece of energy on solving problems which were like around 10% incremental advancements. So this was the problem between innovation and invention, I guess. So in the early 2000s, after AIO deep learning came into play, and especially after 2010, people started focusing on technology stack where that data-driven decision making was part of the equation. So Moonshot Thinking is a framework where you have a huge problem, you have a breakthrough technology, and you have a radical solution. So instead of you do incremental advancements, you focus on radical breakthroughs and try to create solutions that actually can help to leap forward our current understanding of a problem with a 10x impact. So how can we apply this Moonshot Thinking into our localized organizations is something that I've been fascinated, and I've been consulting with much more bigger, larger groups as my professional career. So one of the things that I'm going to tell you is some of the inventions that we've been able to create, and the impact these inventions have. So let's say about depression, what you see here is a technology called vocal biomarkers. So this technology, we actually have the highest accuracy right now in the world for human emotion detection. We publish papers around it very academically. So this is like a work where that you can identify someone's depressed or not by just listening to the audio of the person. That means it's not even understanding what they say. It's about how you say it. So usually in this particular exercise, it takes around a question form called PHQ-9, and to help you to understand what is your depression level. But what we've been able to achieve is we can predict the depression level for 93.2% accuracy with a macro F1 of 0.89 with real patients. We've been able to identify depression from purely the acoustic features, where you can actually it's very magical to hear that a person who's depressed and person who's non-depressed, the voice actually has the information that is required to just understand this classification. So this is purely done through deep learning, and also these technologies need to work in the most cheaper smartphones. It needs to work in the most noisy environments. So designing a commercially viable product around screening helps us to screen, helps us to integrate with chatbots and all the other services to be able to detect someone with depression at very early stage. So this is one of the things that actually we call as breakthrough technologies, where that detecting early a disease actually can help you to just mitigate and navigate through it at a much more faster pace. So then one of the things that this technology applied in 2020 is MIT released a paper where you can actually detect COVID from the way you talk. So one of the most interesting things in this work is that it was able to identify also there's a company called Vocalis in Israel. So that company is also able to identify people that were not showing symptoms. So which we call as asymptomatic patients. Out of 77, you can detect 63 out of that purely just using voice. So which this helps in this kind of situation is that it helps you to do screening much more better way, because I think you guys might have already know this using the temperature regulation machines, or else temperature thermometers. That is not the most effective way of detecting whether someone is having COVID or not, because one thing is it's that test is very similar to put a coin up and then again see which one is head, which one is tails, because the way the disease progresses, some of the people react to it differently, and these biomarkers are actually hidden in a different spectrum. So talking about voice, we can move into this concept where why this is possible is because personal computing devices are getting extremely more powerful. So because of the personal computing devices getting powerful, which means your simple smartphone that you have right now can access to a GPU, and also can run complex machine learning models and helps you to identify different type of disease detections, or else different type of screening technologies in a very cheap environment. So this also gives you the ability to just deploy this in rural areas, deploy this in areas where you cannot carry heavy diagnostic devices. So it gives another accessibility for a different layer. For that means when someone calls you over the phone for a helpline or a center, on the background you can actually identify and screen the person, see whether what type of diseases the person can be having using purely the form of voice and acoustic technology. So like I said, increase accessibility and creating data-driven decisions is what actually going to help healthcare services to scale, especially in developing countries, because more people we can screen, more people we can identify at an early stage, we can actually help them to move forward and to find the help necessary in the given timeline. So talking about invisible features, right? One of the other things that I've been mainly working on is data-driven respiration technology. So this started in 2017 when I was in Beijing, where that we couldn't even walk outside or breathe without wearing a mask because the entire city was looking like brown or reddish. So those days we started working on technologies that what are the next generation of like face masks look like, what are the next generation of wearable technology that you can bring into like respiration healthcare sector, and launched a product called AtmoBlue, which is helping people to breathe faster using adaptive airflow generation. So we won TechCrunch Design Award for this, TechCrunch China for 2018 for this one. So the entire product was built in 6 months, and we delivered around 50,000 units, and within that time. And that's in 2017. Now it's actually pretty and what it does is that it delivers you 118 liters per minute with a filtration of 99.97. So which means people with difficulty in breathing using a mask, this technology can help you to breathe easier. And the second thing is that it also uses a technology where you can design, you can actually measure and identify like, the filter usage and behavior analytics, everything around respiration technology. And the problem with this technology was that like, by the time we were creating it, it was a Tesla type of a product. Even this has been mentioned as like Tesla face mask, because it's actually expensive. So when we moved on with like, the technology forward, we started working with like, wearables where that we wanted to identify how do you know that your mask is working, how do you know that the filters are actually like, performing the way that they should be, and when you should be changing a mask. So we came up with a smart valve technology in 2019 to help like, mask to identify like whether the mask is working well or not. Still, we were not satisfied with the technologies that we were creating. And in 2020, during the pandemic, with Sri Lanka Institute of Nanotechnology, we came up with a whole new solution, which is a breath biomarker platform, which means we can identify the mask fit, its usage, filter efficiency, carbon dioxide buildup, using smart material technology, where that where you can print a sensor on a piece of fabric, or else like a piece of like a flexible PCB, to be able to even identify like things that is more bigger than like that was available. For example, we had to design a sensor from scratch that can identify every single thing that is related to your breath and how that parameters are related to respiration technology, which means like you have a mask right now, you have an add-on sensor, which you just take it and you attach it to your mask, and all of a sudden you actually have created a non-intelligent device, an intelligent device, to be able to identify whether it's doing its job correctly or not. So how this technology came into play is we had to like design from scratch. So this is what's interesting, using localized resources. When the pandemic was like, at its peak, when there was no resources coming from China or coming from other countries into Sri Lanka, the scientists, engineers, and researchers, we all came together and started designing like technology where that our main goal was that can we create a printable respiration monitoring technology where that it can be attached to any respiration equipment, and went even beyond that to be able to detect gases around acetone, ammonia, and other gases purely from exhale. So why is this important? Is just imagine like, a person with diabetes, their acetone level goes up, and by just scanning your breath, now you have a different interface to be able to like detect whether the person is like, doing well or not. So this actually gives access for different type of sensors. For example, people have been like, in our traditional knowledge in Sri Lanka, a traditional doctor would like also see why your breath smells like bad. Most of the time, it's not only related to your oral hygiene, it's also related to your gut health. So people that who have cancer, people have like different type of respiration illness. These all can be detected by breath. So previous slides I was talking about vocal biomarkers, and this is actually around breath biomarkers. And we also went a step ahead and try to commercialize the technology to a point where that the affordability is like, there, so that these technologies can be applied at scale. So that also gives us like, a way to think about what exists. So are the filters the best that they are right now? So also using new filtration technology, using graphene coated filters, oils, activated carbon, and using real-time filter monitoring and management solutions, you are integrating the concept of AI, machine learning, IoT, and also smart materials into one specific platform to be able to design next generations of masks. Because we were not ready when the pandemic came, does not mean that we should be not ready when the next one comes in. Most probably going to be like an airborne virus also. So we should be able to build and design technologies around it, and we should make it affordable so that a lot of people actually can have access for this. So moving into the presentation, we can see that how continuously, where that we started with a PAPR device, going for sensing, going for biomarkers, and now we are working in technologies where you can do all these things using like no batteries, so batteryless. So our goal is to create a sensor and an entire platform less than $1 per sensing. So this is where that you can actually empower current systems, current respiration protective equipment, and give it the ability to just integrate IoT and to be able to connect it into a remote monitoring solutions. So also this actually have huge impact around smart packaging to really understand whether your food is expired or not. So that way, without opening meat or like fish or milk, we should be able to tell what is the real time expiry date, because these things, when they decompose, they emit gases, and these gases can be picked up using very cheap sensing technology. So one of the things that I want to move on from this conversation to the next step is, part of me is actually Chinese in a way, because I've been here for a very long time. I grew up with China when China was like picking up internet technology at scale. So for the past 10 years, one of the things that I've been able to see is that if you walk in a street in China, people are not wearing masks. People are wearing masks. They're taking it seriously, but most of the country has been vaccinated, at least 40%. And then it has been managed really well. So being like China, where the virus actually had the most impact in its early days, to be able to flatten the curve with zero or no cases in major cities, and which means there's a very direct relationship how smart healthcare systems have been integrated into the ecosystem. So when you talk about powerful technologies, they need to be simple by design. So like I said, what you see on the right side hand is a little simple app that runs on WeChat, which is similar to WhatsApp, that has three colors: green, yellow, and red, which is coupled to a very complex computation of city to city, your air travel, who you meet, and your contact tracing, to your vaccination, to all these kind of complex big data infrastructure, where that you would know whether you can go into a space or you can get a cab, or all those logistic services are getting managed by this simple little interface. So it's been integrated to the major payment platforms. It's been integrated for major communication platforms, so that the data is being centralized in one way. So one of the key things that we need to learn from here is that how data-driven analytics and cross-platform connectivity, better user experience with creating very simple steps to be able to do these registrations, and seamless integrations with multiple different OSs, operating systems, mobile phones, and services, and having with powerful content to be able to educate the public around what are the next necessary steps that need to be taken, update when an incident happens, and make sure that you are safe, your community is safe, and also to do it at a high scalability way, that the largest group of people in the planet are using a simple application, a single application, which it doesn't crash. So that requires powerful technology, very smart architectures to be able to integrate healthcare, or else let's say that COVID management, into one specific space. So moving on from that conversation to look at China and the world, and also going into localizing innovation. So integration of smart healthcare systems into developing countries requires us to think differently. So it's not about having technology that is fabulous and wonderful. It's also about like how we can integrate these systems in a cost effective way, making the policies ready, uh, advocating and educating people around the country to be able to be supportive with that. And then when COVID actually hit Sri Lanka, one of the things that happened is there was a huge wave of innovation, local innovation, and to be able to come up with devices that actually helps to mitigate the situation. So we actually did a good job. But one of the things that we need to focus is having one prototype or one device is not like the way to move forward. We should be able to figure out the complex manufacturing internally and build the capacity so that we should be able to create these things at scale. So one of the things that require to do that is capital, resources, and production face when rest of the resources actually go down. So one of the things that we need to think in our sector, as Sri Lanka or else like developing countries, is that how much cost is it to build these solutions for us, and what is the cost to scale this, and then what is the R&D cost, like what is the cost per pilots? Because you can have like a solution ready, but that doesn't mean that having a pilot is easy. To be able to work with organizations or work with governments to do a pilot, and because there's a whole regulation and like a process behind that that actually makes like these things slow. So when a pandemic is at its peak, if these processes and policies are slow, then you can't actually like scale your technologies at to a level so that you people actually can use it without issues. So, and the other thing is around streamlined standards, like how are we protecting users data, how are we building these solutions, are they open source, can like people work on top of them. So these type of like solutions, when we are designing and integrating in developing countries, we need to be really thorough around how these systems are being architected from its origin. So moving on, you can actually connect with us through the email address like given below also. So one of the things that I want to wrap up my thought is that pandemic is the first chapter, and then the second chapter after the pandemic is mental health. So we should also focus on the area where that our countries equipped with enough psychiatrists, our countries good at like coping with like mass distress. So this is another silent killer that's going to come and appear soon after the pandemic, and our healthcare system should be able to support and deal with that. And thank you for listening.